She said, quote, "They cry, they tell me they didn't know. They thought it was a hoax. They thought it was political. They thought because they had a certain blood type or a certain skin color that they wouldn't get as sick. They thought it was just the flu, but they were wrong. And they wish they could go back, but they can't. So they thank me and they go and get the vaccine. And I go back to my office, I write their death note, and I say a small prayer that this loss will save more lives." Dennis, that's so powerful, and that is so raw. And I think that a lot of people, I think most of us can selfishly say, we think of our physicians as almost on a different pedestal, that they are so intelligent. They are doing this work that so many of us cannot do. And we forget sometimes that they are human and they have these emotions and they have these feelings. And when somebody dies, it's not just a number to them. It's not just another piece of paper to sign. It really does touch them.
I think some of the people might not appreciate that she really is. She's trying to do the best she can for all of her patients. And she's trying to help them, but as she says in her posts, they're asking for the vaccine, but it's already too late. They already have the virus. They're already being put on a ventilator. At that point, and hopefully we can be like her and say a prayer and hope that by sharing these stories, that other people will realize how serious this is and will do everything they can to protect themselves and the rest of us.
And she makes a comment in here of saying, and I think you use this as your headline, and I want people to know that we know a lot of people, for better or for worse, they don't read a full story. They read a headline and maybe a couple of paragraphs in the beginning. And one of your headline, I should say, was talking about how there are people who are dying or who are intubated. And she says in this post, she says, one of the last things they do, meaning patients, before they're intubated is beg me for the vaccine. I hold their hand and I tell them that I'm sorry, but it's too late. Now, we know these vaccines are designed to prevent coronavirus and rather prevent serious illness and hospitalization, death. They are not designed to cure coronavirus. So I think what the doctor is saying is that she gets to this point and then people have a realization, but it's too late to go back before they got sick and get this vaccine. And I want you to elaborate on that, Dennis, but first I want to get a couple of quick questions I'm seeing here before they go up too far in my feed. One, Mary Lisa talks about getting vaccines if she's a patient with AFib. Mary Lisa, I'm going to tell you what the doctor said, and that is check with your primary care physician. Call that office. I'm sure they would be more than happy to give you their thoughts. And that goes not only for you, Mary Lisa, everybody. If you do have a question about your specific medical condition, call your primary care doctor, and they will be, I'm sure, more than happy to answer those questions for you. That way you get trusted medical advice, and that is not coming from me. I'm not a medical professional. Now, again, going through some of these comments, I'll get Amy saying, so what about patients who become sick again or die after they get a vaccination? And Amy, that's unfortunately, it's very rare, but that's true. And this is what Dr. Cobia says. She says she's in the majority of her patients did not get the vaccine. At least one did get the vaccine and was sick, but was not having a serious of an illness.
96% of deaths in Alabama since April have been in unvaccinated people. Something like 94% of hospitalizations were unvaccinated people. So there's a small percentage of people who have gotten the vaccine who still get very ill and who still sometimes die of COVID. But if you can reduce your risk by something like 95%, I mean, that's kind of a no-brainer to me. I don't know why you would say, I'm not going to do this if there's a 5% chance that bad things are still going to happen to me.
I'm going through again some of these comments, and one question, I'm not sure that I have the answer in front of me. We can maybe get this for you. Gail wanted to know how many COVID deaths has this doctor seen since the outbreak of the Delta variant. And Gail, I'm not sure if Dennis can answer this question. I am hoping to actually have Dr. Cobia come and talk herself soon about this and about her comments. So, Dennis, do you have an answer to Gail's question?
I do not. I don't have the exact answer. We can look at some of the statewide totals, but I don't have specifically the number of patients that she's seen.